some kind of utopia. We wanted to ensure that we got all the financing in place. We wanted to ensure that we had all the nurses. We wanted to ensure that all the programs were in place before we started a committed and dedicated process to achieving universal health care. I then spoke to the doctors, the CMO, the other doctors, Dr. Eugene. I spoke to the permanent secretary and so many other professionals, and they told me when they look at the research, they realize that there's no country on earth up to today that has achieved perfect universal health coverage, that every country is still struggling to improve their services and to fine-tune their services. So I said, you know something? I met with them and I said, you know what? We are going to start the implementation of universal health care. Guide me. I went to cabinet and said, what are we going to do? We are not waiting for all of the information on financing. We are not waiting for all of the experts to tell us exactly what to do, because if we do that, it's going to be election time and we will not have delivered anything on the universal health coverage. So we said we are moving step by step, phase by phase, delivering to the people, and as we move along, improve the healthcare services, improve the quality of infrastructure, improve efficiency so that we can implement universal health coverage as we move along. And that is exactly what we are doing. I wish to thank all of the healthcare professionals, especially as we are coming out of COVID, the challenges of COVID-19. We have not fully sat down to look at COVID-19. We are going to do so, and I announced a few weeks ago that we will do so as a government and as a people, to look at COVID-19 and what it did to St. Lucia and St. Lucians, what it did to our healthcare services, and how can we improve our healthcare services, and what lessons did we learn from COVID-19. But the COVID-19 pandemic dealt us an additional blow, and what it did to us, it taught us that without an efficient healthcare delivery service, we can talk all the economics that we want to talk about. We can talk about all of the development in the country, but if we do not have a healthcare service to respond to emergencies, if we do not have a healthcare service to respond to human resource needs, then we are running a country without the safety nets that are required. I'm very heartened that we have reached out to the private sector. We have reached out to the private labs. We have reached out to private healthcare professionals, and that work is continuing. We are going to continue to consult with private labs. We are going to continue to consult with private healthcare professionals so that they too can guide us and all of us can work on this project together. I want to say to you that, as the permanent secretary said and others said before me, this is a project which is the dream of so many leaders and so many former ministers of health. And I recognize in our midst today the President of the Senate and her contribution to healthcare. She was the former Minister for Health, the Senior Minister and former Prime Minister, Honorable Stephenson King. And I cannot see everyone, but if there are any other former ministers for health in the House today, or the permanent secretaries, or the health workers who have since retired, I want to tell you we thank you for your service. For me, the job is very simple. I wake up every morning and I know that the people of St. Lucia gave us a mandate. And the Prime Minister gave me a job, and the job is to be the instrument, or to be the tool, together with my cabinet colleagues, which will deliver to the people of St. Lucia. The instruments, we are the instruments which will cause the people of St. Lucia to feel that we are putting them first, to feel that we are doing what we can now to deliver universal health coverage. And for me, as I've said before to the team, universal health coverage is not an abstract concept. It should not be something that can be found in books and in journals, and it should not be something that should be only with professionals and doctors and PhD holders. Universal health coverage should be attained at every level of the health sector. And that is why we have started what we call centers of excellence. And people say in the parliament, what is a center of excellence? That doesn't make any sense. So it makes sense to us because at various healthcare facilities, we are going to ensure that we give more access to the people of St. Lucia. So today we know you go to the Miku Wellness Center, and there are more clinics for men. You can go every third Saturday and you can see your urologist. We are hoping that you can continue to see your nephrologist with our good doctor nephrologist. We are hoping that we are going to extend services throughout the country so that we increase access to healthcare. Pour ça, messieurs et dames, ça nous avons aujourd'hui, je suis bien content parce que nous avons un service pour madame qui go boudin, pour yo pas ni pour ni trois cassements pour boiter tête yo, côté yo kay joindre l'argent pour payer pour ces tests là, pour ces ultrasound et pour ces lab là. Vous attendez ces docteurs bon matin. Ces docteurs de où l'année chay madame yo ka go boudin et presque 9 mois yo pas encore aller faire ultrasound parce que yo pas ni l'argent pour payer ultrasound là. Yo pas ni l'argent pour payer test là. Gouvernement ça là, Premier ministre honorable Philippe J. Pierre avec gouvernement ça là avec ces mon ministère qui a travaillé avec nous qu'a fait pour où ça joindre ces tests ça là sans ou payer pièce l'argent, sans tirer l'argent en poche. Comme ça, issue qui levé bien, s'il y a un problème, c'est nos là avec ces docteurs qui savent avant problème là vient plus difficile. Nous avons cas avec nous mettre les affaires au devant, nous mettre les affaires au premier. I can tell you so much this morning about the Ministry of Health, Wellness and Elderly Affairs. This is not the moment. It is just a moment for pride. It is a moment to be thankful to the Prime Minister for giving me this opportunity to try our very best to lead a team of professionals and a team of caring people who are willing to put their hard work and their shoulders to the wheel to cause this to happen. I cannot leave this stage if I don't thank my permanent secretary, Ms. Jenny Daniel, for her hard work. The Chief Medical Officer, the Director of Universal Health Coverage, all of the nurses, the doctors, all those who are working in the PIU, Ms. Jeanette Hughes and all of the others, the head, Dr. Joseph and everybody else. People are just putting their shoulders to the wheel. And you should see them at the ministry. You should see them running here, running there, making calls, calling the health aides at the health centers, the nursing assistants, the watchmen, everybody, getting everybody involved. Environmental health, Mr. Ragunanan and everybody, getting everybody involved, because what we are building is a team which is dedicated to putting our people first and causing healthcare reform to advance and advance very quickly. This is not an end in it all. Every speaker has said so. This is a step. We are not saying today that we have universal health coverage everywhere. We are saying that we are taking definite steps. We are saying we are going to review draft legislation on universal health coverage, which has been drafted for a while. We are saying that we are taking action, concrete action, so that the people of St. Lucia can get the benefits of our promises. I thank you very much, and I thank Prime Minister and my cabinet colleagues. I thank all those who are assisting us, and we are going to get this job done. We are going to get this job done. We are going to get this job done. Thank you very much.
Thank you, Honorable Minister. He said that we have a team that is dedicated to putting people first and advancing healthcare. I like that. Just before we hear the remarks from the Honorable Prime Minister, part of this team is Nurse Fabiana Nicholas from the St. Jude Hospital, another project close to our hearts. And she just has about a minute to speak about universal health coverage and maternal and child health.
I don't believe that the maternal and child health lunch will help us. I don't believe that the maternal and child health lunch will help us bravely. A lot of the times you have patients coming in, they have no labs. With us doing the labs at the health centers, it will help us gravely. A lot of the times the patients come in, they have no labs, and it's difficult. You have to do the labs actually. Sometimes when the babies are born, there's no way we can initiate breastfeeding because we have no labs available. Also, in doing the labs early, we can do dating, we we can check for abnormalities for the baby and the mother, so we can have prompt interventions. Also with the labs, they can be referred earlier to the high-risk clinic or even to the hospital, so we can initiate treatment. Also with the initiation of the labs and the patients coming in a timely manner, at the end of the day, you have a good outcome. You have, for me, I would say, at the end of the day, you have happy mother, healthy mother.
That was Nurse Fabiana Nicholas over at the St. Jude Hospital. At this moment, it is my esteemed pleasure, of course, to call on Honorable Prime Minister Philip J. Pierre.
Thank you very much, Jade, Excellency, Acting Governor General, President of the Senate, members of the Cabinet, Deputy Prime Minister, Speaker of the House, Permanent Secretaries, members of Team Health, ladies and gentlemen, good morning. After all these speeches and all that information, there's little for me to say. I want to tell the CMO that I did one part, I have one more, and it's too late now. Last month, in this building, I read a budget as the Minister of Finance. And in that budget, I said that this year we would have launched universal health care, a part of it. And as usual, the skeptics were on. The skeptics were on with their usual tales of doom and gloom and lack of confidence in the people of St. Lucia. One of my greatest strengths is having confidence in the people of St. Lucia. Having confidence in the nurses, confidence in the doctors, confidence in the people who make healthcare work in this country. It's not going to be perfect. We're going to make errors. We're going to make mistakes. Sometimes we'll get it wrong. But I'm sure that every day, every professional, when they get up in the morning, they want to do well, they want to do best, and they want to improve the quality of healthcare for the people of St. Lucia. So we may say today, what are we doing? And again, the skeptics will tell you, taxpayers money. And what are we doing? We are speaking about babies and unborn children. And what's that? What's that? The normal skeptics. But you know, he who feels it most knows it. I've spoken to several mothers in my constituency who said to me they cannot afford the basic tests when they are pregnant so that to ensure that they are healthy and their baby is healthy. They cannot afford it. Now, if you can't afford it, you will not mind, you will not care with those who cannot afford it. But we care about those who cannot afford it. And this is why we are doing it here today, to ensure that those who cannot afford it, they get the opportunity to get the basics, the prenatal care that they need so they can have healthy babies. So what's happening here this morning is a significant step. It's significant, it's revolutionary. It's like what's happening in education. It's like what's happening in health. Like what's happening in tourism, community tourism. It's like what's happening in the youth economy. Getting people involved in all aspects of the development of St. Lucia. And this health initiative is something which I support, and I believe that this is just the beginning of the health revolution in this country. And I applaud the minister, I applaud the team at the Ministry of Health. Again, there was a lot of speculation that what would happen when we took over the government. But the difference between us is that we are a responsible bunch of men and women. We are responsible. We do not act out of hatred. We do not act out of vindictiveness. We act out of believing that every man and woman, their intention is good, and we trust them unless they cause us to trust, not to trust them. And this is significant. So I want to applaud the Minister of Health and the healthcare workers in this country, everybody. I want to applaud them, the staff, the non-medical staff, the people who work in the offices, the permanent secretary, every one of them. It's because of your efforts we are here today. And I know my colleague was not very happy with me when he was made Minister of Health. But I'm sure you understand why he was as Minister of Health. And you know, sometimes when you take steps as a Prime Minister, people don't understand. Because you know, you have information that they do not have. I know what I was doing. And when I do certain things, I also know what I am doing. Today is a very, very pleasant day, a very happy day. It's a day where we ought to be happy. It's a day where we ought to say to the people of St. Lucia, this government is working in your interest, the interest of the people of St. Lucia. And regardless of the skeptics, regardless of the deflections, regardless of trying to put us off track, we're going to be focused. We're going to be focused on the people, and we're going to ensure that after, when we've left that scene, at least we can say that under this government, the people were better off. Thank you very much.
Thank you very much, Honorable Prime Minister Philip J. Pierre. At this point, I would like to let you in on some information from the Ministry of Health and specifically the team at UHC. You see, as the train has started, we will not stop. We now have the UHC logo competition, which will be launched I would like to say by next week. We have everything in order, so we will be launching it very soon. Those of you who are watching online, I know that I have not acknowledged you as yet. Those of you on NTN and MBC, please go to our Facebook page. That is Universal Health Coverage St. Lucia. Give us a follow, and you know, we post almost every day. So you will have information. Any questions that you have, I will personally answer. And that's the goal, for us to ensure that the lines of communications are kept open between the unit and the public. Now, we want the public to participate in the launch of the UHC logo competition. Not the launch, but the UHC logo competition. It is a logo and naming competition. Universal health coverage is our own. It's everyone. It is for everyone. And therefore, we need your participation. And to this end, we would like people to send in their names, to come up with a nice logo for UHC. As you can see, we just have the name out there written out, but we do not have a logo. And that will be down to 1 or 2 lucky St. Lucians who will design the logo and come up with a name for UHC. So it could be UHC St. Lucia. That's not very creative, but you know, you can come up with something more creative than that. Of course, the prize, there's a wonderful prize here. I think everybody likes the sound of it, those who we have spoken to, and that will be about $6,000 for the winner or winners. Honorable Hille, I don't think you can participate, you know. Yes, so we want you to come up with the name for UHC St. Lucia and also come up with the logo. So you can work together as a team, and I know that we have so many talented people in St. Lucia. So it is open to one and all. The criteria will be up on our Facebook and Instagram pages. Do give us a follow. And if you have any questions once it has been launched by next week, you can send that to our inbox. You can also call us. We will have all all the information out there. You know, they're like ticks at the Ministry of Health. We don't let anything go. And we also have the UHC champions. I did mention the community champions earlier, but we also have UHC champions. One of them is with us today. That's Arthur Ale. We have Scadi.P. We have Solange Alfred. So many people, influential people in the community, and you'll be seeing them very frequently on your different news outlets or your preferred news outlets also. So that is the information on the UHC logo competition. Moving on, we are going to go on to the unveiling and handing over of the UHC voucher. And for this, I would like to call on Tracy. Are you ready? Okay, you can join us on stage, Tracy. And I'd also like to call on, once again, Honorable Prime Minister Philip J. Pierre, Dr. Alicia Eugene, okay. And this is Tracy, who I've been speaking about so frequently here today. Tracy is a pregnant mother, a pregnant woman, I would like to say. And Tracy is going to be the very first recipient of the UHC voucher. This is very significant here today. So on stage right now, we have Honorable Prime Minister Philip J. Pierre. We have Permanent Minister Mosley Baptist. We also have Permanent Secretary Jenny Daniel and Miss Tracy.
Okay, so to persons who do not know what the voucher is, it is the document that will be given by the midwife at the wellness center or the obstetrician gynecologist at the wellness center to the pregnant women so that they can access the lab test and the ultrasound test. Okay, so when a patient comes to the wellness center, although the doctor or the midwife who's seen the pregnant patient will order labs and ultrasounds, they would only be able to access the lab services and the ultrasound services when they have an attached voucher to the lab or ultrasound or the test or the form. So persons must understand, to get this voucher, you must go through the wellness center, and this voucher is the ticket that will allow you to access the lab and ultrasound services at no cost. Thank you.
Thank you, Minister and team. And Tracy, whoever told you that labor was hard, tell them that's not true. Labor is good for you. Take it how you want. Okay, at this time, I would like to call on Arthur Ale with a special song. Let's welcome him.
All right. Can we get a big round of applause for this initiative, everybody? Come on. You can do better than that. Can we get a big round of applause for this initiative, guys? All right. Had I known this was coming out with another year to have my daughter. But all right, I can make another one. Let's go. This one is for all the mothers of St. Lucia, the soon-to-be mothers, all the aspiring mothers. Let's go. So for the mothers of St. Lucia, can I get a little wave in the air, everybody? Turn it up. This one's for you, mama. I say, this one's for you, mama. I say, this one's for you. This one's for you, mama. I say, thank you for the life that you give. Now they all know my name. Well, they all know my name, mama. I say, thank you. Without you in my life, things just won't be the same. Whatever I say, you are there. You ready? So let's go. Come on. Through all the good times, you were there, and even the bad times. When I needed something, you were there. Say, mama, you were there. Mama, you were there. When I had nobody, you were there. And life was against me, you were there. So mama, forgive me. Yeah, I can't repay you, cause this one's for you. For everything that you do, you always see me through. Mommy, I thank you. I said, well, this one for you. For everything that you do, you always see me through. I want everybody under the tents all around. Give a little wave for St. Lucia mothers. Let's go. Take a wave for your mama, and now start to jump for your mama, and just raise your hand for your mama, and let we celebrate every mama. I say, take a wave for your mama, and now start to jump for your mama, and just raise a glass for your mama. Hey, for your mama, listen, my queen. Well, I could never put no one else upon you. I say, upon you. Well, I say, my queen. Hey, everything that I do, but I do it for you. I need my choir one more time. You are there. 1, 2, 3. Say, through all the good times, you are there, and even the bad times. When I needed something, you are there. Say, mama, you are there. Mama, you are there. When I had nobody, you are there. Life was against me, you are there. So mama, forgive me. Yeah, I can't repay you, but this one for you. For everything that you do, you always see me through. Mommy, one more time I tell you about this one for you. For everything that you do, you always see me through. St. Lucia, for St. Lucia mothers, elevated mothers, wave your hands one more time. Come on, take your way for ya, and now start to jump for ya, mama, and just raise your hand for ya, and then we celebrate every mama. I say, take your way for ya, mama, and now start to jump for ya. We are all St. Lucians. Any proud St. Lucians say, make some noise. If you love your country, St. Lucia, make some noise. What are you telling me? Say, I am a St. Lucian. Yeah, pretend you have a flag. Pretend you have a flag. Let's give it a little wave. Give it a little wave. And that place so sweet. Melodies in the heat. Everybody's on the road. We jumping for one goal. To head is soca play. I'm a culture on a display. Everybody say we vibes a special way. To see the people playing, everybody celebrating. The music sounds so sweet. It's the only way you feel it. I'm proud of where I'm from. I need you to understand. If you're truly proud, let me hear you. Put your 2 hands in the air. Everybody thank God that I am a St. Lucian, and I come from the land of sun. I tell you thank God for the hell. Show me love on you, anything together. 1, 2, 3, everybody. Hands up, fire, Lord. Hands if you follow where you're from. Hands it's gonna be our one. If you are a St. Lucian, hands Charlie party up in there. Hands pushing people everywhere. Hands raise up. I want you to clap your hands. Clap your hands for the see. Clap your hands for all the hard-working health workers. Clap your hands for St. Lucia. Clap your hands for the Ministry of Health. You ready? I want you to show hold somebody hand next to you, put it in the air, and show them St. Lucia unity. No, let's go. Just see the people playing, everybody celebrating. The music sounds so sweet. It's only we who feel it. And I'm proud of where I'm from. I need you to understand. I am a St. Lucia. One more time. Show me the hands. Let's go. Thank God that I am a St. Lucian, and I come from the land of sun. I tell you thank God for the land of the West. Simply beautiful. Everybody together. Let me see your hands. I know that. sister. So I want to say Saudi.
Thank you very much, Alpha Ale. Let's hear it once again. I think that was a great way to end the launch of universal health coverage. If you agree, put your hands together. Thank you. Where am I seeing? Yeah, no, honestly, Shamak, you've done a wonderful job, but I'll get to that just now. Wonderful job as usual. Right now, I'd like to call on Nurse Persia Ajuda, Public Health Nursing Supervisor, to deliver the vote of thanks.
I would like to adopt the protocol previously established, and I wish to greet everyone and say a pleasant good morning. I would also like to recognize Your Excellency, the Governor General, Cyril Errol Charles, the Prime Minister, Honorable Philip J. Pierre, Minister of Health, Wellness and Elderly Affairs, Honorable Moses Jean-Baptiste. I feel honored and privileged to be presented this opportunity to give the vote of thanks on behalf of the Ministry of Health, Wellness and Elderly Affairs on this momentous occasion. Hillary Clinton said, I quote, "If you want to know how strong a country's health system is, look at the well-being of its mothers." End of quote. Essentially, a bright future begins with healthy mothers, healthy babies, which translates into healthy families, communities, and the overall health and economic stability of the population. Today, I say today, marks an auspicious period for mothers, babies, and our families, and certainly the beautiful Helen of the West. As a midwife, as healthcare providers, and St. Lucians, we rejoice today at the availability of laboratory services and imaging studies at no cost to pregnant women through the primary healthcare level, which we know definitely, or rather, I would like to say, beyond a shadow of a doubt, will assist with overall wellness of expectant mothers during the antenatal, intrapartum, and postpartum periods, and a healthy infant at delivery. Psalm 127 verse 1 says, "Unless the Lord builds, the builders labor in vain." Deepest thanks go to God for taking St. Lucia to phase 1 of universal health coverage. We see your hand in this, Papa God, Lord Jesus, and we say, thank you, Lord. We can give him a hand. Yes, he did well. God did well. I would like to thank the government of St. Lucia for not only recognizing the current situation, but ensuring that expectant mothers would receive the care needed, and by extension, their families. You have placed women first. The Prime Minister, Honorable Philip J. Pierre, thank you for your encouraging remarks. The Minister of Health, Wellness and Elderly Affairs, Honorable Moses Jean-Baptiste, we recognize your interest in health and your desire to ensure health for all. You inspire others to get the work done. Thank you. Merci. To the Governor General, to the members of Cabinet present here today, thank you for being here. Thank you for your support. Sincere thanks to the Permanent Secretary of the Ministry of Health, Wellness and Elderly Affairs, and the team for your leadership and your support over the years and ensuring this UHC project came to fruition. Thank you for your remarkable speech today. Dr. Sharon Belma George, Dr. Lucia Charles, Piano Yolanda Ascendo, thank you for your profound speeches today. Dr. Alicia Eugene Ford, the UHC Project Director, enthusiastic, energetic director, a say it and do it Dr. Eugene. Staff members will define her at work with the 4 P's: prayerful, powerhouse, pitbull, poo-pool. Well, a good poo-pool she is, Dr. Eugene. She pushes and gets the work done. We applaud you. We applaud your work with UHC Project. And from our hearts, we say thank you. You have done excellent. A special thank you to your secretary, Ms. Marva Shalmine, her communication officer, yes, Ms. Jade Brown, and her infographic technician, Mr. David Remy, for their hard work throughout the UHC journey. To all the members of the staff of the Ministry of Health who worked along this new UHC unit to push the agenda forward, such as the financial analyst, Ms. Anthony Philgens, Ms. Junette Hughes and her team from the PIU unit, Principal Nursing Officer and her team, Quality Assurance Officers, Nurse Heidi Kodra, Mr. Len Leons, Dr. Glenford Joseph, Officer of Health, Ms. Nadesh Smith-Lambert, Officer in charge of the Bureau of Health, Mr. Hamish Aldonza, Transport Officer. Special thanks to Ms. Natalie Matre-Bastien and her team from the Office of the Prime Minister, and a Consul Serioza Snack from the Attorney General's Office. We want to thank you for all your support and team-spirited approach to attaining UHC. It took a team. Our valued partners, World Bank and Pan American Health Organization, we graciously thank you. Pastor Peter Samuel, thank you for inviting the presence of the Lord with us today. I also extend thanks to all the presenters. They were wonderful. Give them a hand. For your outstanding performances. Well done. Mistresses of the ceremony, you did well. Great job. Thank you. To the persons who set the foundation in the early phases of the UHC, we tip our hearts in appreciation to you. I convey thanks to all distinguished participants, healthcare workers, invited guests, community stakeholders who were present at this gathering. Your presence reflects your support to UHC Phase 1, Maternal and Child Health in St. Lucia. To the people of St. Lucia, we express sincere thanks for your collaborative approach to the stakeholders' engagement. Thank you for sharing your views with us. Nutanu, we heard you. It is here. I cannot thank everyone enough for the involvement, support, and their willingness to take on the completion of tasks beyond their comfort zone to ensure cooperation in the organization of this ceremony. Mistresses of the ceremony, this beautiful ceremony. Ladies and gentlemen, once again, I want to state that we are all most grateful to all, to everyone. We thank you for being here with us this morning. It has been a great pleasure. We are making every woman and every child count. Thank you very much, everyone. Merci beaucoup tout le monde. Please have a wonderful rest of the day. Thank you.
excellently delivered, Nurse Judah. Thank you once again for that. At this moment, I would like to invite our invited guests, ministers. Please stay seated as the community champions will serve you refreshments. Once again, thank you so much for being here, Julita.
It was indeed a pleasure serving with you, Jay, the UHC Communications Officer, walking the talk and living by example. You have been a wonderful audience. It was my pleasure serving you this morning.
Julita, I just hope that in a few months' time you will be walking the talk and living by example too. Okay, so thank you for coming. Members of the press media, thanks again. Shamak Designs, thank you. Fine Line Graphics, thank you. Please, those of you who are listening on the outskirts, those of you who are invited, members of the press, please follow us on Facebook and Instagram. Please stand as His Excellency, the Governor General, exits.